So we'll start this week talking about the thymus gland. Now the thymus, remember from lecture, is very difficult to see in an adult patient because as we age, the thymus itself just gets converted to fat. We don't need to develop our immune system as we are older. So an adult patient is just going to have, like you can see here on this CT, like a fatty area posterior to the manubrium and anterior to the aorta. So if you look in this area on most patients, you're going to see kind of like this triangular fatty area, and that's the remnant of the thymus gland. Okay, if you see something in this area, it's probably a pathology and is probably the reason why you're doing the CAT scan. So again, in adults, you're not going to see any bilobed gland here because it's all been converted to fat. I couldn't find a CT of a pediatric patient to show you the difference, but as you guys scan patients, especially pediatric patients, I want you to be mindful and look in this area, posterior to the manubrium, anterior to the ascending aorta and the pulmonary trunk, kind of in this area. And you're going to see this triangular area. You'll actually see the bilobed thymus gland. Okay. Next thing we'll talk about is the trachea and the esophagus. So I'll go up on this scan. And again, just like any other scan, these 5 scans are in the course located under Research Helpful Links under Module 5. So go through these and scroll through, and just like I'm doing now, so that you can visualize and see the anatomy. Okay, so trachea. Trachea, again, very easy to see, this nice circular air-filled tube in the center of the chest cavity. As we travel down, you can follow it all the way down until it bifurcates at the carina into right and left main stem bronchi. And there you go. Here's right and left main stem bronchi. So what I want you to do is I want you to go back up and then look at this density just posterior to it, okay? That's your collapsed esophagus, okay? So as we go up, just posterior to the trachea is the esophagus right here, okay? It's a tube, it's collapsed on itself, and if there's nothing in it, it just looks like this dense area. But you can see kind of in some areas you're starting to see, oh, there's a little bit of air, okay? So it's gonna have little pockets, teeny pockets of air, and it's gonna start to shift to the patient's left as we enter the chest cavity, travel through the thoracic cavity into the abdominal cavity. It's going to take a turn to the left. Here we go. It's still here. Here it is, air in there, in that one area. It's going to take a turn to the left as it enters into the stomach, okay? Here it's going to start. It still has a little bit of air down here, okay? It's now going to go a little anterior. And here's your stomach, okay? It's your stomach right here. So here's your esophagus entering into your stomach. So follow the general area like I did. This collapsed tube, there you go. As it travels through the thoracic cavity, right here, kind of going a little posterior now, right posterior to the trachea. There's a little bit more air all the way up, okay? So there's your esophagus. Start up, follow the trachea down, this density posterior to the trachea, and look for air pockets. You will see teeny air pockets in most patients. Okay, smushy little area there, a little bit of air. Okay, we're below the carina. Okay, and remember the esophagus, there we go, is going to now kind of go a little anteriorly, just inferior to the heart. It's going to start to move anterior. Here it goes as it empties into the stomach right here. Okay, there's your pylorus. I'm sorry, your fundus. Pylorus is inferior. There's your fundus. It's emptying into the fundus. Okay, so there's esophagus. Moving on to the lymph system, I'm going to switch over to the cisternochyli. You're not really going to be able to see the thoracic duct unless there is an abnormality with it. So what I want to show you here is this little area right here is the thoracic duct superiorly. And as we travel down, remember kind of at the area of T12 to L1, you have a dilated area, and that is the cisternochyli, which is just where that confluence of where all of those inferior ducts, lymph ducts, are kind of emptying into the main thoracic duct. There's this bulging area, and this is it right here. Now, this is an abnormal cisternochyli. This is a large cisternochyli, so there's something going on with this patient. So inferiorly, we have the duct, and then it's this hugely dilated area. Most patients, you're not going to see this. You might be able to make out the fleck of the thoracic duct, but again, it's going to be very difficult to see. So on this patient, I did want to just point out the large cisternochyli, and if you just look in the area of T12 to L1, that's about where it is. If you do see something that is kind of grayed just to the right of the descending aorta, that's your cisternochyli. Okay. Moving on, let's go to the heart. I'm going to switch over. Actually, let's talk about, I forgot about this, the Hodgkin's lymphoma. So we have, remember we talked about the lymphatic system. You're not going to see the lymph vessels unless there's an abnormality. So if you look at this patient that has Hodgkin's lymphoma, this patient has a bunch of swollen lymph nodes. So starting all the way up in the thorax and going down, remember the lymph nodes are going to follow the major vessels and organs. So here's a dilated lymph node. Anytime you see these clusters of stuff, and right in here, here's a whole bunch of dilated lymph nodes, all surrounding the pancreas, the aorta. All of these are lymph nodes, okay? So I just wanted to point that out, that normally you don't see that, but in this patient, it's very prevalent because they have lymphoma. So that's cancer of the lymph glands themselves. All right, so let's move on to the heart. Heart circulation and heart anatomy. So let's first start with these two patients that have pericarditis or a pericardial effusion. So remember we talked about the linings of the heart. We have the visceral pericardium and the parietal pericardium. So your first outer layer is your parietal pericardium. That is going to be the lining outside of the heart, closest to the thoracic cavity. Okay, so this is this guy right here. And then your visceral pericardium lies right along the heart itself. Okay, and it's actually synonymous with the outer layer of the heart wall, which is the epicardium. Okay, so it's in direct contact, the visceral pericardium, with the outermost layer of the heart wall itself, which is the epicardium. So without any pathology between these two spaces, the parietal and the visceral pericardium, we wouldn't normally see this space, the pericardial space. But this patient has pericarditis, so they have inflammation of the serous fluid that sits between the visceral and the parietal. And then this patient has a pericardial effusion, so they actually have an increased amount of fluid in that pericardial space. Okay, so just wanted to point that out so you can see, and the important thing to see here is that your visceral pericardium lies in direct contact with the outermost layer of the heart, which is the epicardium. Okay, so now let's move on to the chambers themselves. Let's go, does this have a coronal? It does. Okay, so here's a coronal view of the heart, and maybe the effusion will help us to visualize a little bit better. So remember we have the four chambers. The most posterior chamber is your left ventricle, the posterior inferior chamber. And remember, it points to the left, and this is considered the apex of the heart, okay? That's your apex of your heart. The base of your heart is made up of the most superior portion of the heart, and the remember, it's the top portion. It's not the inferior portion, because apex would kind of make us think that it's the top, but that's actually down here. And the base is actually at the top, up here, in the top of the heart. Okay, so that's your most superior portion right here of your heart. Okay, so there's your heart. It's divided into thirds. The first third of the heart lies to the right of the midline, and the next 2/3 lies to the left of the midline. Okay, and then our other borders are right border, our left border, our superior border, and our inferior border. And then we also have our surfaces. We have the anterior, which if we go most anterior here, this is your sternocostal surface, the most anterior surface. Our inferior surface is our diaphragmatic surface. And then the left surface of the heart over here is your pulmonary surface. Okay, so those are your surfaces. Those are your basic anatomy, and then radiographically speaking, right, left, superior, inferior. Moving on to the specific chambers. Okay, I already mentioned left ventricle is the most inferior, posterior. As we go anterior, you need to see the right, it's hard to see on this slice, right ventricle. And then atria is hard to see on this view. Here's your left atria in here, and here's your right atria over here. Okay, so those are your heart chambers. Let's look at them in an axial view. Switching to axial here. Okay, let's start superior and go down. This is our pulmonary artery. I think it's easier if you see the pulmonary arteries, your main branch, your main pulmonary trunk, and then your right and left branches. And we know that that comes from the right atrium. So if we go down, here's your your right ventricle. So follow that down, that's your right ventricle here. And then that gets your blood from the right atrium, which is here. And then the superior vena cava, here's your inferior vena cava. And then your superior vena cava over here, right here, empties into your right atrium, right here. Okay, so that's your right atrium to your right ventricle, right atrium here to right ventricle here, and then follow where that comes out to your main pulmonary trunk, and then your right and left pulmonary arteries. Okay, so it's the right side of the heart. Remember, the right side deals with deoxygenated blood. Okay, it's feeding this deoxygenated blood out to the lungs to travel all the way down to be have that gas exchange to be converted to oxygenated blood. So now coming back into the heart, we now need to go into the left atrium, which is right here. Left atrium sits posterior to the aorta. Left atrium into left ventricle over here, the biggest ventricle right there. And then the left ventricle goes to the trunk, the base and trunk of the aorta right here, and then out of the heart. And here's ascending aorta, arch, and then descending aorta down. Okay, so let's do that again. Let's start inferiorly. I think that's easier. Let's look at your, if we follow the circulation, I find that to be easier to help me follow the atria. I think the ventricles are easier to see. I think the atria are harder to see. So if we start on the right side of the heart, let's look for our inferior and superior vena cava. Okay, so here's our superior vena cava here. As I go down, it's going to empty into my right atrium. Here's my right atrium. And if I keep following that down inferiorly, I'm going to have my inferior vena cava. Okay, so they come together to form the right atrium. Right atrium dumps into right ventricle right here. So here's your right ventricle, and then the right ventricle is going to pump blood out the main pulmonary trunk coming from the right ventricle here, main pulmonary trunk, right pulmonary artery, left pulmonary artery. Okay, remember that's deoxygenated blood. Okay, so that's the right side of the heart. So now we need to look at our blood flow coming back into the heart from the pulmonary veins, which you can kind of see here. Inferior is located posteriorly. Inferior, anterior, or the superior, and then the other one, it's hard to see without any contrast there. Here. Anterior, superior, dumping into the left atrium. Left atrium dumps into left ventricle, this guy right here. Left ventricle is going to become the aortic base right here. Here's where it's pumping out of the left ventricle into the aortic trunk. Ascending aorta right here. Aortic arch right here, and then descending aorta traveling down here. Okay, so there we go. That's our chambers of the heart and cardiac circulation. Our great vessels, let's switch over to a CTA. This should make it a lot easier to see. We also have thinner slices. Let's do that again with contrast, because this is going to actually help you to see the chambers as well. All right, so let's go down, follow the main vessels. Let's follow the circulation in the heart. So first, what's coming into the heart? The superior vena cava. Okay, here's your superior vena cava right here. Coming down, down, down. That is going to empty into your right atrium. Here's your right atrium. And if I keep following this atrium down, it's going to become the inferior vena cava right here. Okay, so going back up, here's your right atrium. Right atrium dumps into right ventricle. Okay, and remember systole and diastole. Systole is contraction. The right atrium contracts. The right ventricle is in diastole. It's relaxed. So this is going to contract and pump into a relaxed right atrium. Right ventricle right here. Here's your right ventricle. Much easier to see with contrast. So we can now follow as this is pumping blood out of the right ventricle. It's going to pump to your main pulmonary artery. Here's your main pulmonary trunk right here. It's going to immediately branch into your right pulmonary artery and left pulmonary artery here. And then that's going to branch off into your lobar, segmental, subsegmental, all the way down into the portions of the lung. Okay, so that's your right side of your heart. Left side. Okay, let's look at the left side. What's feeding the left side of the heart? Pulmonary veins. Okay, this oxygen-rich blood has exchanged at the alveolar level out into the lungs. It is now going to be dumping via the inferior and superior pulmonary veins into the left atrium. Okay, so superior and inferior. Here's our left atrium. So let's look at the four vessels, the superior and inferior. Remember, superior is anterior, inferior is posterior. Here is right there is your inferior, and right there is your superior. Okay, dumping into your left atrium. Left atrium during systole contracts and pumps blood into the left ventricle that is now in diastole or is relaxed. Okay, and then here is your entire left ventricle. What I want you to see on this image is this nice bright white area in the center of the left ventricle, and then see this thickened area around it. Remember that the myocardium, the cardiac muscle in the left ventricle, is thicker than the myocardium in the right ventricle. It is 3 times thicker. That's why I'm seeing a little bit of thickening of the myocardium in the right ventricle, but in the left, it's 3 times thicker, okay? Definitely you should be able to visualize that, especially on a good arterial study, okay? I have nice opacification of my heart chambers. So, left ventricle. Left ventricle receives that oxygen-rich blood from the left atrium that has received the oxygen-rich blood from the inferior and superior, inferior and superior pulmonary veins directly from the lungs. It is now going to pump that highly oxygen-rich blood out through the aortic trunk, the ascending aorta right here, and then we have our aortic arch here, and then we have descending aorta. Okay, other things we talked about, remember we talked about that collateral blood flow. We have that venous collateral blood flow, the azygos and the hemiazygos. Remember the hemiazygos is on the left side of the heart, the left side of the vertebral body, and the azygos is on the right. So if we head down inferiorly, I want you to see this vessel and this vessel right here as I keep going inferiorly. This is the hemiazygos vein. This is the azygos vein. Okay, it comes up, remember, from the ascending lumbar, right and left ascending lumbar. The hemiazygos right here is a continuation of the left ascending lumbar vein. The azygos right here on the right side is a continuation of the right ascending lumbar vein. They're going to come up together, one on the left, one on the right, which actually goes more anterior of the lumbar vertebral body. And then at some point, the hemiazygos is going to cross over and dump into the azygos and become one vessel. And here it is right here. You can see the hemiazygos coming over. It's now traveling anteriorly. It is joining up with the azygos. The hemiazygos is no more, and now we have the azygos vein right here. The azygos continues up anterior to the vertebral body and will eventually cross over anteriorly and dump into the posterior aspect of the superior vena cava. And you can see it's starting to go anterior here. Here's a nice shot of that long view of the azygos vein traveling over and dumping into the superior vena cava. And you can see here, remember the vena cava is venous blood flow. It's deoxygenated blood traveling from the rest of the body, the superior vena cava, from the head and the upper extremities rather, dumping into the right atrium. So what I want you to see here is, because this is a contrast study, where is the contrast coming from? The contrast is coming from an IV in the patient's arm, right? So if the superior vena cava takes deoxygenated blood, or blood that's coming from the upper extremities, if I have an IV in one of those upper extremities, I'm going to get this bright white contrast in my superior vena cava because it's receiving that contrast directly from the subclavian vein of whatever vessel the IV is in. And I can tell by looking at this scan that the patient had an IV in their left arm, because look at the subclavian vein coming over right here, filled with bright white contrast. This is an arterial study. My arteries over here are not lit up. None of my veins are lit up, but my left subclavian vein is, because my left subclavian vein right here is receiving the contrast directly from the IV in this patient's left arm. comes over left brachiocephalic. Remember, it's long transverse brachiocephalic vein, dumps into the superior vena cava. So bright white contrast coming directly from the left arm dumps into the subclavian vein, into the left brachiocephalic, down into the superior vena cava. And what I want you to see is at the point where the azygos dumps into the posterior aspect of the superior vena cava, see how it's muddied in here? That's because you have all of this venous blood flow that does not have contrast in it. It's coming from the lower extremities, the vertebrals, remember, are dumping into this. Has not received dye yet, because in order for the dye to get there, it would have had to go on through the heart and be pumped through the heart. This is why the timing of certain studies is so important, because you have to know where the contrast originates from and where it has to go in order to travel to the rest of the heart, or the rest of the body from the heart. Oh, Lord. You just lost it. Hold on a second. Loading images. Okay, so let me get back to that slice. So where are we? Azygos dumps into superior vena cava. The azygos vein has deoxygenated blood. The contrast is in a phase that has not, it's in an arterial phase. So we have not had this contrast circle throughout the rest of the body yet. It's just getting to the heart. The left ventricle is just getting contrast. It's just pumping it into the aorta, and the aorta is just pumping it out to the rest of the body. So if I have this dark contrast in my aorta, that means that I have an arterial blood flow study, but I haven't quite gotten to venous flow yet. Okay, remember we've talked about that. So I'm seeing arterial vessels, but I'm not seeing venous vessels yet, because it hasn't had enough time to travel through the body. So because of that, my azygos vein, which is receiving deoxygenated blood, it's venous blood from the lower extremities and the lower lumbar area, I am dumping deoxygenated, or blood that does not have contrast in it yet, into this highly opacified superior vena cava that is directly receiving contrast from the left arm. So that's why you can see the deoxygenated blood looks like a filling defect. It would almost look like a clot in there, but it's not a clot. It's just because the azygos is a pretty big vessel dumping into the superior vena cava a bunch of blood that has not received contrast yet, because it hasn't gone through the venous system. So there's your azygos dumping into the posterior aspect of the superior vena cava. Okay, so we've talked about the heart chambers. We've talked about the basic flow. Let's just go over the, what do we have to talk about yet? We talked about the pulmonary veins. Remember, the oxygenated blood comes from the pulmonary veins. Inferior right here, superior right here of the left side, so left superior, left inferior pulmonary vein, left superior, left inferior pulmonary vein coming into the left atrium. That feeds your oxygenated blood to the left atrium, left ventricle, and then out through the aortic root, out through the aorta, out to the rest of the body. Let's see if we can see in a good cross-section the papillary muscles. We might not be able to see them in this contrast study, no, because the contrast is going to hide it. Let's look at maybe this. Does this have a coronal? Yes. This is kind of a crappy study. It's not very clear. No, can't see it. In some studies where it's really good, this is the resolution, and this is kind of off. But if you have a really good ECG gated CTA, or not a CTA, rather a regular study, you can see where the atrium and the ventricle at the tricuspid and the bicuspid valves, you can see that papillary muscle, but we're not seeing it here. So don't worry about it. Sometimes you can, sometimes you can't. The last thing we have to talk about is the, we talked about the three sections of the aorta, ascending, arch, and descending. the branches. So let's talk about the branches. Let's go over to our CTA again. The main branches of the aorta. Okay, here's the aorta, left ventricle, root, and here's your ascending aorta. Here's your arch, and then here's your descending aorta traveling posteriorly behind the heart. So we have ascending aorta coming out. Your very first branch coming out of the right side of the heart is going to be the brachiocephalic trunk. And here's your brachiocephalic trunk. It's easiest to see in this plane. Brachiocephalic trunk goes up, and it's going to split into the right common carotid and then right subclavian right there. Okay, subclavian artery, right common carotid artery, right brachiocephalic, first branch. Second branch is going to be your left common carotid right here. Following that up, right here, it's going to travel all the way up to the left side of the neck, feeding the brain oxygen-rich blood to the left side. And then the very last branch right here is your left subclavian artery. There it goes. There it is. There it travels over and comes back anteriorly over to the left upper extremity. So those are your three main branches. You should definitely be able to see them on a coronal slice. Venous flow, the tributaries of the superior vena cava, we can see it here because remember I told you we have an IV in the left arm of this patient, and the subclavian vein that's coming over is right here. So we have left subclavian vein over here, left subclavian, left internal jugular combines to form the left brachiocephalic. It is longer than the right brachiocephalic vein. You can see it here. And that's just because it has to travel from the left side of the body to the right side, because the superior vena cava, which is seen here, it's kind of muddied because this is the aorta coming up right here. But you can just kind of see the superior vena cava here. Superior vena cava emptying into the right atrium, and then the inferior vena cava coming up inferiorly into the right atrium. And I want you to see here, again, remember we talked about the azygos coming in posteriorly? There's your azygos. Here we're looking at it directly on end. So it's coming directly at us into the posterior aspect of this superior vena cava, dumping right in. That's why we're seeing this nice perfect circle of that deoxygenated venous blood flow that does not have contrast in it because it's coming from down here. Okay, so there's your azygos right there. You can follow it posterior. Keep following it as it goes down. There it is. Okay, there's your azygos. It's pretty big. Let's now look at, from a different view, let's switch over to the axial and look at the same thing. So you should be able to recognize them in an axial and in a coronal. I won't ask you sagittally, it's just not as easy. So let's start up top and go down. Okay, we have our left arm, our left subclavian coming over. Here's left subclavian, and if you look, there's the equivalent vessel over here, but see how it doesn't have contrast in it? That's because the IV isn't over here, and we haven't reached venous flow where the contrast could travel through the rest of the body. Okay, so here's your left subclavian vein coming over, dumping into the left as we go down. I'm sorry, I'm going up. As we go down into left subclavian right here, down into your left brachiocephalic right here, coming across. Remember, it travels transverse, and it's going to dump into your superior vena cava right here. Okay, there's your superior vena cava. Venous flow, harder to see because we don't have a venous study. You do have to know the branches. It's just going to be difficult for you to see. I would have you recognize the left brachiocephalic, especially on this study if it shows up on a test, because the left subclavian is where the contrast is, coming over into left brachiocephalic, dumping into superior vena cava. Okay, now let's switch over to the aorta. Here's your aorta, ascending, descending, coming up into the arch. Okay, so we're traveling superiorly. The very first branch I'm going to see coming off on the right side, so I'm going to be looking over here, is going to be my brachiocephalic trunk. And here it is right here. Brachiocephalic trunk, as you travel up, it is now going to bifurcate into two separate branches as it travels up, brachiocephalic still until it branches. And here we have right common carotid and right subclavian, okay, arteries right here. There's your right subclavian traveling over to your right extremity. Here's your right common carotid traveling up into the neck and then up to the head. Okay, so that's your first branch, very first branch coming off of the aorta. Back to the aorta, let's look at the next branch. The very next branch I should see traveling from the right side to the left side, or from the ascending to the descending, is going to be my left common carotid. And here it is. Here's my left common carotid coming up, and then the very next one is my left subclavian. Okay, common carotid you should be able to follow all the way up into the neck, and then the left subclavian is going to take a turn and travel over into the left extremity right here. And you can see how this is the vein and this is the artery traveling over. Okay, vein, artery. See how the venous flow here is much brighter than the arterial flow, and that's because we haven't quite opacified the artery as much, and the contrast is coming directly from this extremity. When we look over in the opposite extremity, see how my vein, my right subclavian vein traveling down is not as bright. There's no contrast there because we haven't gotten to venous flow yet, but my artery is opacified. Okay, so those are that's the anatomy you should know. You should be able to recognize any of this for a test, anything that I've reviewed in the axial and the coronal planes. Okay, so both planes you should be able to recognize all of that anatomy.